Hello there. My name is Jay Giordano, and I'm the founder of Pillars of Good Health. And I wanted to take a couple minutes to kind of explain what we're about and how we came to be. I had been in the field for over a decade before I had decided to go back to school for a master's degree in counseling. And in that process, I was able to examine the way I work with clients out in the field, and that's how the pillars came to be. If I could further explain it, we are a coaching model. The coaching model essentially is, I think of a therapist and a client generating a list of goals they want to work on. Where we come in is we create an action plan with that client out in the community to achieve those goals. So it takes the theoretical process a step further in cultivating good routine. That's kind of how we work. And we do that through all 5 phases of the ways that we have the Pillars of Good Health. There are 5 areas, and I'll just briefly touch upon each of them. Our first one is the collegiate care, and we provide a coaching model for clients who may have a mental health break in college, may have some mental health issues that come up in college, and we'll coach them and work with them to help them get them through that process. Our second level of care is what I call our supportive apartments. And the supportive apartments allow a client who might be coming from a place like an inpatient psychiatric stay or a halfway house stay where staff is there 24/7 they graduate to less checks and balances of a supportive apartment where they live with a roommate out in the community and staff is available but not on site. So it provides sort of that same coaching model and a way to build them to full independence, which brings us to our next stage at Pillars, which is called our community-based mental health. Community-based mental health. We work with people out in the community in their own apartments or condos. They may live with their family, they may have a roommate, and we will come in to their apartments and work with them, again, using that same coaching model to help them manage life and deal with things. Our next level of care is what I call our Psychiatric Care model. And I've seen some clients for many years, and they've aged into this, where clients may need more support. They will live in an assisted living facility that will certainly help provide food and shelter and basic medical care, but we will provide the psychiatric care. We will provide the coaching model again and act as geriatric care managers, managing all their medical appointments as well as their psychiatric care needs. Our last and final part of Pillars is going to be our neurofeedback model. And neurofeedback is a way to brain train that we work with a client who has a lot of brain dysfunction and difficulties going on, and it works with them to help them function better and be able to implement skills that a client may be working on with a therapist much more effectively. And that's kind of how we work, and I'd love to talk more, and you can see it in our website, other parts of Pillars. Thanks a bunch.